Hey y'all, Dr. Parker Pet Vet here. So there's a couple things going on in veterinary medicine that I thought a visual would help to explain. So we are practicing curbside care a majority of the time, and clients are calling all the time. I think because they're spending more time at home with their pets, they're noticing more things. Maybe their pets are getting into more stuff. There's more injuries since they're more active with their pets. And we are seeing a lot more calls. We also have a ton of new clients that are calling with new puppies and new kittens. And so we're seeing a ton of clients calling. And we have a lot of people saying, why are you booked out so far? What is going on? We don't understand. So I thought I would do a visual using Connect 4 to show you kind of what we're experiencing right now in veterinary medicine. So this is your average day, and you have usually 2 to 3 doctors there, okay? The yellow represents routine appointments, so wellness appointments, things that have been booked for a couple weeks, things that have been booked out in advance, and then the red represents sick pets. Now, you also have technicians that have spots for things, and you have receptionists that have spots for things. Receptionist spots are going to be prescriptions that need to be filled, questions that need to be answered, just things that need to be attended to that you're going to have phone calls about. The technician ones are going to be nail trims, anal glands, doing an ear treatment, flushing ears, things that technicians need to do that a doctor doesn't necessarily need to do. So throughout the day, you already have your wellnesses booked, you have a couple nail trims, maybe some grooming, some messages that you need to answer. And then on top of that, you start getting the phone calls during the day. The sick one, the vomiting one, the itchy pet, the dog that is limping, the pet that is, I don't know, throwing up. Throwing up is really common right now. And so your sick ones fill up. Then you start getting your drop-offs. And the drop-offs are gonna go where the technicians can help you manage them and handle them. So this is all the sick ones calling during the day. Ring, 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 phone's ringing off the hook, drop-offs. This is also overflow drop-off. As many kennels as you have, you're filling them up, you're fitting in what you can during the day because you want to see as many pets as you can to help them out. As many patients as possible. And then this is your receptionist. This is the phone calls of the, oh my gosh, I'm going out of town. I need this prescription right away. I need anti-nausea medication, or hey, can I just pick up more ear meds? Okay. So this is your kind of normal day. This is how it books up. This is how you manage everything. So let's see what we're experiencing in curbside medicine now. Okay, so now you're experiencing curbside care. And so what that means is you still have, right, your staff, or do you? So let's say someone's coughing. Let's say it's one of your doctors. Well, that person's staying home because who knows if they have COVID or not. You need them to stay home. Oh wait, now you have technicians that are out because you have technicians that are sick, or they have to stay home for childcare reasons, or someone in their family is sick. Now also, the phones are ringing off the hook because you're doing curbside care and everyone has to call when they get there. They have to call when they check out. So each appointment has added 2 phone calls during the day. There are things you can do to alleviate this, but the phones are still ringing off the hook right now. So your receptionists pretty much don't take extra phone calls during the day unless they absolutely have to see that. So now you have the same amount of people who are calling, and you actually have more people calling because so many people are getting new puppies and new kitties. And so now your sick ones, oh man, they are filling up fast. Most of the sick ones are actually filling up before the actual day of. So then you're saving your drop-off spots, right? But now there's only 3 drop-off spots because you have 40% of your staff that's out because they're sick right now. And then on top of that, you don't have as much kennel room because you're taking drop-offs. So this is what you end up with, except this is also what you end up with. People calling constantly, people calling constantly, people calling constantly. So you have less staff, less room, less people to get things done, more people calling, and we are going insane. So my advice to you is, if you have something for wellness, plan that it's gonna take a couple weeks to be worked in at your veterinarian most of the time. If it's routine, let them triage your pet. I promise you, if it's something that has to get done right away, we will fit you in, but we definitely have to save room for the sick ones. And understand that a lot of places are understaffed right now because people are sick. Some people do have COVID. Some people are just sick and they're staying out to be safe. Some people are staying home because they have this family member who's sick, or they have a child that they have to take care of. So there's a lot going on in veterinary medicine. Just be kind, try to be understanding, and realize we're doing the best we can. And we really appreciate everyone who supports us and who understands. I hope this visual helps. I know it's kind of silly, but this is really what we're experiencing. and I hope that things get better for veterinarians, because I know a lot that are really burned out right now. So make sure you're kind to your vet, maybe leave a kind review, support them, make them a treat, make them a goodie, and just say thank you. Thank you goes a long ways. Thanks guys, and have a good day. Thanks for watching.